Most people think that death in old age comes without warning. But what if it doesn't? What if the body has been whispering softly, gently for months, even a year in advance? As a caregiver or simply someone who loves an aging parent or spouse, you may have noticed small changes but brush them off as just part of growing older. The truth is, the body often gives subtle signs before life nears its final chapter, and recognizing these signs early can make all the difference. In today's video, we'll walk through 5 quiet but powerful indicators that may suggest an elderly person is entering their final year. This is not about fear, it's about understanding. Because the more you know, the better you can offer comfort, presence, and peace. It's part of living healthy after 50, not just for ourselves, but for those we love. When we recognize these signs, we gain the chance to honor life, not just manage decline. Before we begin, please take a moment to like this video and subscribe to the channel. And tell me, have you ever noticed a small change in a loved one that later turned out to be serious? I'd love to hear your story in the comments. Now let's gently uncover what the body may be trying to tell us before it's too late. Number 1, extreme fatigue and weakness. It often starts small. A nap that gets a little longer. A walk that feels heavier than usual. Maybe a favorite activity, gardening, crossword puzzles, chatting on the porch becomes something they just don't feel up to. At first you tell yourself they're just having a slow day. But then the slow days don't go away. This isn't normal tiredness. It's not what happens after a bad night's sleep or skipping breakfast. It's a deep bone-level exhaustion that rest doesn't fix. Even sitting up in bed can feel overwhelming. The muscles lose their strength. The legs feel like sandbags. Climbing stairs or walking across a room becomes an effort that takes everything they've got. Inside the body, quiet changes are unfolding. The heart pumps more slowly. Circulation weakens. Organs begin to conserve their energy for the most basic tasks. The body's not giving up, it's redirecting, saving power for essential functions. And that means anything extra movement, conversation, digestion starts to feel like too much. This is one of the most powerful signs that the body may be entering its final year. Because when someone who used to be strong and independent begins to fade in energy, it's not about motivation, it's biology. Metabolism slows. Oxygen doesn't circulate as well. Muscles don't repair like they used to. Even the brain starts dialing things down to conserve energy. Ruth, a 79-year-old from Wisconsin, had always been full of life. She loved baking and calling her sister every morning. But when her daughter Lisa came to visit one spring, she noticed something had changed. Ruth wasn't getting out of bed until noon. Her coffee cup sat untouched. And halfway through a phone call, she simply said, "I think I need to lie down." Lisa thought maybe it was depression or boredom, but the truth was Ruth's body was slowing down. This level of fatigue also affects emotional well-being. Many seniors begin to withdraw, not because they're disinterested, but because the effort is too great. Conversations feel like work. Hosting a visit feels impossible. Even answering a phone call can be draining. It's easy for family members to mistake this for sadness or apathy. But often it's simply the body signaling that it's nearing its natural end. A study published in the Journal of the American Geriatric Society found that persistent fatigue in older adults is one of the strongest predictors of declining health and mortality in the following 12 months. It's not just a symptom, it's a warning bell. One we must learn to hear if we want to care deeply and act wisely. If your loved one is suddenly taking longer naps, skipping meals out of tiredness, or avoiding daily routines they once enjoyed, it's time to pay close attention. Not to push them, not to fix them, but to understand what their body is quietly telling you. This is where aging gracefully advice truly matters. Where senior health becomes less about doing more and more about choosing peace. Gentle care, compassion over correction. These are the daily habits for longevity that don't aim to stretch time, but to deepen the quality of what's left. And this is what over 60 wellness often looks like, not a battle against age, but a soft landing into it. A time when sitting quietly beside someone may mean more than anything you say. When love isn't loud, it's present. Extreme fatigue isn't just a phase, it's a message. And when we listen, we help our loved ones live their final chapter with dignity, not denial. Number 2, frequent infections and slow healing. As we age, the immune system naturally becomes less efficient. What once took a day or two to bounce back from now lingers for weeks. A mild cold can turn into bronchitis. A tiny cut might swell, redden, and take far too long to heal. It's not just aging, it's a sign that the body is struggling to protect itself. And that struggle often speaks louder than words. You might notice more frequent visits to the doctor, more rounds of antibiotics, more days spent in bed. What used to be minor illnesses suddenly feel bigger, longer, harder to shake. And sometimes the symptoms don't follow the rules. There may be no fever, no coughing, just unusual tiredness, confusion, or a sudden loss of appetite. When circulation weakens, the skin receives less oxygen. That's why bruises hang around longer, scratches close more slowly. A blister from a tight shoe can become an infection risk. The body simply doesn't heal the way it used to. And for seniors in their final year, this is often one of the clearest signs that something deeper is happening. Jonah, retired librarian from Ohio, always prided herself on being independent. But after a mild urinary tract infection at age 81, things changed. She recovered, but then another infection came, then another. Despite medication, each one seemed to take a little more from her. She grew weaker, confused, and within months her family noticed she could no longer recover like before. According to the CDC, pneumonia and urinary tract infections are among the most common causes of hospitalization in adults over 65. And when they happen repeatedly or take longer to heal, it may indicate a deeper issue. Not just infection, but the body's declining ability to respond. This is where senior health tips matter most. Not just in what we treat, but in how we shift our mindset. Because when someone enters this stage, the goal is not always to cure, it's to comfort, to ease pain, to prevent stress on a system that's already tired. Families often wonder why old treatments stop working, why antibiotics lose their effect, why recovery takes so long. But it's not about the treatment failing. It's about the body needing rest more than rescue. This is when senior home remedies can help not to reverse the decline, but to support dignity, keeping the skin clean, staying hydrated, offering soups that are easy to digest, using warm compresses instead of harsh medications. These small acts become powerful tools for peace. Preventing aging diseases isn't just about catching things early. It's about watching the quiet signals like slow healing or unexpected infections. These signs don't always show up on a chart, but they speak volumes when we're willing to listen. When infections become frequent and healing feels like a long uphill walk, it's time to pause, to shift from pushing the body harder to holding it more gently, to stop asking it to fight and start asking how we can bring comfort to the days that remain. Number 3, increased confusion or emotional withdrawal. It can start with small slips. A familiar face takes a moment too long to recognize. A name is on the tip of their tongue but never arrives. They pause mid-sentence, unsure what they were saying. At first, it might feel like typical forgetfulness, but over time, the changes grow deeper and harder to ignore. The brain, like every part of the body, depends on blood flow and oxygen. When those begin to decline, mental clarity begins to dim. The person may seem lost in familiar places or struggle to follow conversations they once enjoyed. They may forget where they put their glasses or forget what glasses are for. These moments can feel brief at first, but slowly they become more frequent, more lasting. What's even harder is the emotional withdrawal that follows. A once talkative parent may grow quiet. A grandparent who always remembered birthdays now avoids phone calls. Not because they've stopped caring, but because thinking, speaking, and connecting have become exhausting. The world moves too fast. The noise becomes too much. And so they begin to pull away. James, an 84-year-old from Oregon, was always the one cracking jokes at family dinners. But one Christmas, his daughter noticed something was different. He sat quietly at the table, barely touching his plate. When someone asked about a story he'd told dozens of times, he looked confused and said, "I don't remember that." By spring, he spent most of his time alone in his room, softly humming to himself. According to the Alzheimer's Association, nearly 1 in 9 people over 65 in the United States are living with Alzheimer's or related dementia. But cognitive decline near the end of life is not always a disease. Sometimes it's the body's way of protecting itself, pulling away to preserve what little energy is left, making the mind quieter, softer as the body prepares to let go. This is where doctor tips for older adults become so important. It's not about fixing memory. It's about understanding what's happening underneath. Knowing that when someone forgets your name, it doesn't mean they forgot your love. And when they sit in silence, it doesn't mean they don't want you there. It means your presence is enough. Natural health for seniors includes more than herbs or remedies. It includes creating an environment that feels safe, keeping routines simple, reducing stimulation, offering quiet companionship instead of long conversations, playing soft music, holding their hand. Aging gracefully advice isn't always about staying sharp or social. Sometimes it's about recognizing when someone is changing and meeting them with patience, letting go of the need to correct or remind, and instead offering warmth, stability, gentle love. If your loved one has become more forgetful, more distant, or less engaged, try not to take it personally. These may be signs that their brain is doing the best it can in a body that is slowing down. And what they need most is for you to stay close, even if the words fade. Because in the quiet moments, what lingers is not the conversation, it's the connection. And in the end, that's what they'll feel most. Number 4, major breathing or circulation changes. When the body begins its final phase, breathing changes are often the most noticeable sign. You may hear deep, uneven breaths, followed by long, silent pauses. The rhythm may speed up, then slow down. This isn't from exertion or anxiety. It's the body's quiet way of saving energy. Breathing becomes less about function and more about transition. Many families notice a new sound in the chest, a soft gurgle, a crackle, a faint wheeze. Often called the death rattle, it can sound alarming, but rarely causes pain. It simply means the body is no longer clearing fluids efficiently. The muscles that once kept the airway open are now resting. These sounds may come and go, but they signal that the body is gradually letting go. Listening without fear helps create calm in a moment that often feels uncertain. Your peace helps them find their own. Hands and feet begin to feel cold. The nose, lips, or fingers might take on a bluish tint. This happens because the heart is redirecting blood flow inward toward the lungs, the brain, and the core. Circulation to the skin and limbs becomes less important. The outer body cools while the inside focuses on survival. Mildred, age 87, from Georgia, had lived alone for nearly 2 decades. Her son noticed during a visit that her fingertips felt like ice. She was bundled in a blanket but still looked pale. Over the next few days, her breathing grew slower and she began sleeping more. Though there was no obvious illness, her body was preparing quietly, gradually for goodbye. According to research published by the National Institutes of Health, irregular breathing patterns, such as Cheney-Stokes respiration, are common in the last days of life. They often appear before other major signs, giving families a short but meaningful chance to prepare. Understanding these changes helps reduce fear and makes room for deeper compassion. What seems frightening becomes manageable when we know what it means. That knowledge brings comfort. In these moments, senior health isn't measured by blood pressure or lab results. It's about comfort. Soft pillows to keep the chest elevated, cool water for the lips, a quiet room. These simple acts are more powerful than medication. Longevity tips are often about prevention. But at this stage, longevity means peace. It means less talking, more presence. Less doing, more being. To prevent aging diseases is still important earlier in life. But once these breathing changes appear, the goal shifts. Now, the most loving choice is to offer stillness, to let the person feel safe, not scared, to surround them with gentle calm. Families often ask what to do when their loved one begins to breathe this way. The answer is not to panic, not to rush to the hospital, but to slow down with them, to be there. Speak gently, use soft lighting, play quiet music, hold their hand if they welcome it. These are the final acts of care. This is not the moment to fix, it's the moment to feel and to trust that the body in its wisdom knows how to rest. Even when the breath is shallow, your presence can speak louder than words. And in those quiet, fading moments, love becomes the air they breathe. Number 5, unexplained and ongoing weight loss. Weight loss in older adults is often seen as normal. But when it happens suddenly and continues despite eating, it's not just about calories. It's a signal that the body's beginning to let go. The systems that once processed food, absorb nutrients, and maintain muscle are slowing down. Even favorite meals don't bring the same energy they once did. You might notice clothes fitting loosely. A belt that once held snug now sags. The arms and legs look thinner. The face becomes more hollow. These outward signs reflect deeper changes happening inside. The digestive system weakens. Protein isn't processed well. Muscles begin to shrink even if the person is eating regularly. The body may stop feeling hunger. Food loses taste, texture, and comfort. What once was enjoyable becomes a chore. James, 82, from North Carolina, always loved homemade stew. His daughter used to bring him a warm container every Sunday. but she began to notice the bowls weren't empty anymore. He said he was full after just a few bites. Over a few months, he dropped 20 pounds. The doctors couldn't find anything new, but the truth was the body itself was quietly winding down. According to the Journal of the American Medical Association, unintended weight loss in older adults is a strong predictor of mortality within 1 year. It's not just about eating less. It's about the body absorbing less, digesting slower, and holding on to fewer nutrients. The machine is still running, but at a lower speed. This is where senior health tips must shift. It's no longer about bulking up or adding protein powders to everything. It's about comfort, about dignity, warm soups, easy-to-chew snacks, hydration, a familiar favorite even if it's just a spoonful. The Senior Nutrition Guide changes at this stage. Calories take a back seat to joy. The focus becomes kindness, not quantity. Forcing food rarely helps. It can frustrate both the caregiver and the person being cared for. Instead of pushing full plates, offer small bites more often. Let them choose what sounds good. Keep food soft, warm, and simple. Drinking enough water, even in small sips, can help ease digestion and reduce fatigue. These are the gentle tools of natural health for seniors. The emotional side of this is just as powerful. Watching someone lose weight and shrink can be heartbreaking. It feels like they're fading, and in some ways they are. But fading doesn't mean suffering. It can mean quiet acceptance, a slow return to simplicity. Families often ask, should we try supplements? Should we change the diet? The real question is, are they comfortable? When the answer is yes, that's a victory. Not every loss needs to be reversed. Some are part of the journey. Unexplained and ongoing weight loss in the final year isn't a failure. It's a natural progression. The body in its wisdom knows what to release, and in doing so, it prepares itself and those around it for what's ahead. This is a time for presence over pressure, for care over correction, for love over fear. Because sometimes the most nourishing thing we can give isn't food, it's simply being there. Quietly, kindly, completely. These 5 signs: unexplained weight loss, deep fatigue, confusion infections, and breathing changes are not just medical symptoms. They are gentle signals that the body is preparing for a quieter chapter. When we recognize them, we shift from fear to understanding, from reacting to responding, from doing more to simply being there. This part of the journey is not about giving up. It's about showing up with calm, with care, and with love. It's about creating peace when the body begins to slow down and helping our loved ones feel safe even when words fade. That is the heart of aging gracefully advice. Whether you're a caregiver, a spouse, or a devoted child, you don't need to fix everything. You only need to be present, a hand to hold, a voice that says, I'm here. Sometimes that is the most powerful care we can give. If this video helped you see things more clearly, please like it, subscribe to the channel, and turn on the notification bell. Your support helps us continue sharing trusted guidance for those who want to live healthy after 50. Together, we can make this journey softer, wiser, and full of meaning. Your health is your greatest wealth, and so is the peace you give to someone you love.